So my name's David. Oh, so I'm a doctor by trade. So I'm an infectious diseases doctor who has always made my career out of looking after patients, but have been very involved in managing the COVID outbreak since about June last year. And one of the important lessons I think I've learned, and there's been a lot for all of us who are working in COVID to learn through this whole process, is that how a lot of this works really well is when there's a good conversation, is that there's a lot of information and a lot of knowledge and a lot of wisdom on both sides, on all sides, in fact. It might be the case that those working in the response know a lot about how things should work ideally to contain the virus, but ultimately people are the experts in their own lives. And having a conversation that brings all that together, that brings all that everybody knows about their own lives, their own communities, together with what's known about the virus and everything we can do to protect our loved ones, our families, our communities. It's really important that we have a good conversation to share all of that. That really, I think, is the background to why we're all here tonight anyway. And so what I might start doing is sharing what we know about the most recent outbreak that we've had, this last couple of weeks or so. What we know is that this virus, and it's the similar sort of virus to what we saw last year, but has spread really through the community primarily. And it's gone in ways that are very hard to track. So it might go from a house to another house, or via the shops, or sometimes to a stranger who we don't know. And it's doing that when all of us have been going about our lives, moving freely. It's been a challenge because the most important thing we can do to stop the virus from spreading is to stop meeting another person, to stop having a face-to-face talk with another person, to stop being close to other people, which of course doesn't come very naturally. And particularly when we didn't get those freedoms for so long last year. And I think a lot of us were very traumatized and really suffered through those few months. I think many of us have come to really enjoy the time we've had in the last few months where we've been able to freely see our families, see our friends. But there's a trade-off. And that trade-off is that the more we freely engage and talk with everybody, one, the more chance there is to pass the virus on. And two, if we do pass the virus on, it's harder and harder to catch it, to find out everyone who's been exposed before it's had a chance to get out of control. But what we have seen this time round is that we've managed to get it under control quite quickly. It's been what, I've lost track, maybe 10 days, 14 days, I think, since this outbreak started. And now what we're starting to see is all the new cases that are coming up, that we're seeing become sick in the last few days, are people that we already know about, that we've been able to trace them. We've been able to find them before they've become a case. We've been able to tell them that they're likely to become a case in the next few days because they've been exposed. And that is the most important thing that we can do as the Department of Health to stop the spread, is to find out who's about to get sick and to tell them, to warn them, to stay home, to be safe, to stop it from being able to spread any further. And in doing that, if that one person who is going to become sick stays home and doesn't spread to anybody else, then we control the outbreak. And that's been the real fantastic lesson of this last couple of weeks. And if there's one message that I could get across, it's important for us to communicate. But when we hear this risk, when we know that there's a chance that any of us might be the next case that could happen, that is, that we're a contact, that we're told that we're a close contact, or that we need to stay home, or that we need to isolate, or we need to quarantine, all these words mean the same thing, that we need to let some of those freedoms go for a short period of time to stop the virus from spreading to anybody else. And that's obviously been relevant in your area. We've had a recent outbreak around the sort of West Melbourne, North Melbourne area recently that impacts a very large community. including yours. And sometimes the messaging changes. Sometimes we say on one day, these are the people who are at risk, who might be the next case. They need to stay home. And the next day we say, oh, actually, it's these people and then these people, because this all moves very quickly. We find new information, we find new cases, and we have to be flexible. We have to accept what's happened and know that sometimes things grow and grow quickly and that we have to adjust. But the bottom line is the same, is that when we need to stay home, we need to stay home. And that helps protect our loved ones. It helps protect our community when we get the information that it's our time to stay home. That's really the key underlying message. We are thankfully getting to a time in this outbreak where that spread seems to be slowing. But one important message is it's not over until it's over. One leak, one extra spread is enough to start everything all over again, which is why sometimes it's really hard to understand, oh, we've had one case or two cases. Why do we need to lock down for another week? Why do we need to not go anywhere for another week? And the reason is because we have to be 100% certain there's still not one more person out there who could be spreading the virus, because it grows so fast, it spreads so fast. And if we give ourselves the license to move freely, to go about interacting and talking and chatting and meeting lots and lots of people again, it'll spread like a bushfire, and put us all back to square one all over again. So our strategy, our tactic, the whole time has been to absolutely contain this thing as much as we possibly can, and to be 100% sure, so that way, when we do open up, we open up properly, we open up safely, we open up feeling calm and sure that we can now enjoy our freedoms, safe in the knowledge that the virus has been fully, completely stopped. I think that's probably the key messages I want to get across. I know it's only a short spiel, but I really like to have a conversation and question and answer. Was that the intention, Laura, maybe to open up straight away to hear questions?
Yeah, I think we can do that because Ben Cowie is not coming on until 6:30.
Yeah.
David, before we do that, because we do have some time, I just want to speak on behalf of Cohealth and North Richmond just to provide that reassurance to community, that we are here for you locally, to work with you in community and to continue to keep you safe and informed about what's happening. And so although we, our services look a little bit different over at Cohealth in Fitzroy and Collingwood and over at North Richmond, we are ultimately here to do the same thing. And we have our wonderful community staff, a number of who are here tonight, and they work with you guys every day to provide information. If you feel that you have a question that you don't want to address tonight, but you'd like to come down and see the concierge, the community teams on site at Cohealth or at North Richmond, we are here definitely 5 days a week, and at the moment we're here 7 days a week to provide that reassurance, that information, the testing. And we just encourage you to come down and have a chat, and we can also give you masks, sanitizers, tell you what events we've got going on, that type of thing. All of that information will help to keep you safe. So it's just important that, I'm sure you're pretty well aware of the services we provide now, but we really encourage you to come down and have a genuine chat with our teams all the time. And I might just now open up to questions to David, please, about the current outbreak situation.
Should I keep an eye on the chat? Is that the easiest way?
Yeah, Laura, it might just be worth covering off that you can please use the chat function, and Sally will keep an eye on that. You can also use the raising the hand function on Zoom, or literally just raise your hand on the screen. If your camera is on, we'll see you, and you can ask questions that way.
Sorry, no one's speaking, so I thought I'd take the opportunity if I'm not being rude. I'm sorry that I joined a bit late, but then it's very good. Absolutely delighted to actually meet Brendan, Laura, and Emma, and many other people that are here again. So I think that we are in the stage of lockdown. There's a few things that I just want to add in. Number one is actually North Richmond is actually very high Vietnamese population. I wish that there would be signs that with Vietnamese written that actually around the place and actually to support the people around there. The other thing is actually I know that the North Richmond Community Center have the Vietnamese bicultural staff there as well. But I believe that you should have staff there that actually at all the times that's who can speak Vietnamese or other culture there that is there, because I noticed that I myself, so I need to go down and get myself tested. There's a lot of actually information out there that I'm not. If I were non-Vietnamese English speaker, I would be struggle to answer them. So that's the kind of things that I would put to. The other thing would be, when people booked online to get tested, and I'm sure that actually North Richmond Community Health Center, I'm not sure whether you have to book yourself to go down there and test it now or not, but it's a significant of significant of actually effort to go in there and do that. I'm assumed that is the case for the non-speaking English, and I think that at the moment we should actually trying to interact with members of the residents a bit more, particularly with the issue of actually getting people to get vaccinated. I know that the rate of the people who are getting vaccinated at the moment is pretty good. I was jokingly saying to my friend that I feel this lockdown is actually a blessing for us, because I feel that people are getting more vaccination, but I feel that there are a cohort of group that actually still hesitate to do that. And I do feel that the elders, members of the Vietnamese community who are not actually getting that through. The reason being, I believe that actually just a lot of mixed messagings that are going around to the community, and that's also in terms of the government, and also that the other thing, which is we never have any clear guideline of what we need to do, so therefore we make changes as scientific evidence review. So that makes sense, but that's in terms of that's creating a lot of confusion to people. So I think that we better find a way. My message thing would be out to the community member would be that I would expect Australia borders to reopen again, okay, sometime soon, so that Australia can get back to some sort of normality, okay. But I would not expect any people that come into Australia without a vaccination, without any vaccines. So in order for them to come to Australia, we need to actually see whether they have the AstraZeneca vaccination or the Pfizer vaccination. Then I would actually expect the reciprocal approach. So therefore, if we want to go overseas, we would want to do that as well. Another point we need to point out that is actually at the moment, yes, it has been a very unfortunate case. One person has died from the blood clot, okay, but from then we have understood a lot more. I think the medical staff have understood a lot more. They can help a lot more if you go and get yourself vaccinated now, rather than wait until when the borders start to open up. The hospital will be in a very stressful situation. So I'm sorry, I'll just loosen it up there.
It's good, really good. Really good feedback to us at North Richmond, and certainly we do pride ourselves on having a diverse community who work on our teams, and also sort of take your points about the borders opening. And look, I think we're all very, very hopeful that through this vaccination program, what it does is it allows us to be free in our movements, and travel and work and do all those things that we like to do. So it's really important. So thank you, Bon, for sharing your thoughts. It's much appreciated. Can I ask if anyone else has any questions at the moment?
Okay, thank you.
Thank you.
Bye. Hello.
Please go ahead. Is it Julia?
Yeah, Julia, yeah.
Hello. You have a question for us?
Hỏi gì?
He doesn't know.
What's meeting? Yeah,
Anh hỏi đi, tôi trả lời, tôi dịch cho. Anh không hỏi là tiếng Việt, tôi dịch được cho anh.
Cái này là cái gì, họp về cái gì anh hả? hỏi gì chuyên gia nữa.
The question has been asked that what meeting are we in for? So would you mind if I say something like that in English, in Vietnamese for him?
Yes.
Cái phiên họp này là về ở bên Bộ Y tế họ họp để mà họ giúp đỡ cái nạn mà lockdown cái kỳ này đó anh. Nó đang nói về cái vấn đề sức khỏe cũng giống như là nó liên quan tới coronavirus và chích thuốc ngừa đó thưa anh.
Okay.
Anh muốn hỏi gì thì anh cứ hỏi. Hỏi bằng tiếng Việt.
Do you have a question?
Dạ.
Anh có câu hỏi gì không?
Dạ không thì để hỏi được hết trời. Yeah.
Okay, so he said he have no question. Maybe he'll just wait.
No problems. We do still have some time before Ben joins us to talk about the vaccinations, which I know you're all really keen to focus on tonight, which is really exciting. But does anyone have any other questions for David about the current outbreak situation? Anything that's causing you concern? We can please ask David at the moment. It'd be a great opportunity.
In the meantime, I might raise a couple of points, particularly that Bon just touched on then. And
Sure,
I think one is about testing. And I think testing and vaccination often introduce similar problems. All of us have our sort of ideas about how we feel, I think, and that goes for everybody. And one of the common problems we've seen is when someone has a cold or when someone has hay fever or something really minor, they say, well, it's a cold or it's hay fever, and they get on with their life. But the problem can be is that COVID often looks exactly like a cold and is exactly like hay fever. And one of the really, really important things I want to say is if you're sick, even with something really minor, even a bit of a runny nose, bit of a sore throat, bit of a fever, and you're feeling okay, but just not quite right, getting a test is really, really, really important, because what can be a cold for you can be something really severe for someone you love, because it can spread and make other people much more sick than it might make you. And so if I can leave with that message to say any symptom, if you feel unwell at all, getting a test is really, really important. Every case we find is another 10 or 50 cases that we stop from happening. If we don't find them, many more cases happen, many people get sick. So it's so important. Even a little bit of a tickle in the throat, a little bit of feeling unwell, getting a test is really, really important.
Thank you so much, David. I noticed we've got in the chat, and Sally from Belgium Avenue Neighbourhood House is monitoring the chat as well, and we thank her. I forgot to say thanks earlier for also taking some minutes this evening. Sally, did you want to take over there just in terms of the chat for Maria and see whether we can get someone to help?
Yeah, I'm not sure if that's from Maria.
I just ran that through Google Translate, and it's just replicating Pfizer's message, offering that if anyone has any questions, they can post them in language.
Oh, good.
Thank you so much, Maria. I can't see you on screen at the moment, but thank you. That's fantastic. I think I saw, Khadija, did you have your hand up? Hello, Khadija. Welcome.
Hello, everyone. Thank you. I'm just joining in today, so I have some familiar face I have seen already. So hello, everyone. Thank you for the chance. So my question is just clarification. I really get a bit confused when I hear the news and what I am hearing from the Yarra community group. So my question is, who will be eligible right now to get the vaccine? Just clearly, yeah. Please, thank you. I appreciate
Thanks.
it.
Thank you, Khadija. And you're way ahead of us. We are actually going to have Ben, so Professor Ben Cowie is coming shortly, in just a few minutes, and he's going to talk to you, all of you, about who can get the vaccine now, and then we're going to talk to you about how you can get the vaccine. So that's, if you just wait about 4 more minutes, we'll start to talk about our vaccines. So thank you, Khadija. Just seeing if there's any other questions.
If there's no more question, can I throw in something as well? I mean, just something echoing David's just picking on the test. That's all. I mean, I myself, I feel very mild symptoms, and I actually have to stop from work and actually get myself tested. I have to go to 4 locations before I could get myself tested. So that just to show that, you know, at the residence home, you are very fortunate that you have the testing site on site, which is very
Yes.
helpful as well. Another thing which I know that actually country that other than in Australia, I know that every time that you have a symptom, you are required to get yourself tested, and that every time that you do, it will cost you $50. Okay, and for us, it's all free. So you get yourself tested, you are actually keeping yourself safe and your family and community safe as well. So that's all I can
Thank you,
put
Bon.
to you.
That's really true. We do have really excellent access to our testing sites at Collingwood and at North Richmond Community Health. So please use them. Please just come down and have a test. Bree from Cohealth, you've got your hand up, I believe.
I did. I don't seem to have the function, so I physically put my hand up. I apologise, Laura. Bon, I was interested before when you were saying about the older members of the Vietnamese community having some hesitancy. In a couple of these other forums, we've heard of younger groups also having some hesitancy. Have you heard anything that you could share with us about younger people within Vietnamese communities?
Oh, we do, just because, you know, when you get the different message, because normally with the younger member of the Vietnamese community, they probably will be influenced by the older generation. So when they heard, and with the older generation, what they do is they sit at home and they listen to YouTube, and they're taking in a lot of actually health advice. And I must say that actually I did actually give this feedback to the ministers of health at the federal level, and I did say that there has been a lot of actually mixed messaging that I see going around, and I respect that the media should be reporting whatever out there, but you know, there has been very mixed messaging out there, and it's quite confusing as well. And particularly, for example, okay, at the moment, before that, there was only people that over 15 can get the Pfizer, can get the AstraZeneca, and now that if people who under 15, 40, that you have the choice to actually have that as well. That I think is a bit more inconsistency. The message we have to get out there is very clear. The Australian government have never bypassed any of the step that actually get the vaccine trial out. So this is not a trial. This is a real solution out there. One other thing that I see that people do not know, which is in my community, I know that Vietnamese people from Vietnam, did you know that the United States have opened their borders and actually bringing visitors in already? And people from Vietnam, for example, you have to pay a huge sum amount of money to get this kind of vaccination, from AstraZeneca or Pfizer, but they don't. They get the Chinese version, and they don't want to use that. So what they do is they actually buy tickets to go to the United States. It costs them a lot of money, but they do that just because they want to get themselves vaccinated. This kind of message, we have to put it out there. Right, so they don't know that, but I can tell you that the younger people are influenced a lot by the older community as well. But they themselves also read a lot of media. When you read a lot of media, then you with the lack of knowledge of the medical's understanding, I think you would cast a lot of question. When you cast a lot of question, then you will pose and think. When you pose and think, you don't get yourself vaccinated. That's the problem that I see.
I'm just gonna cut in there if that's okay. And
I'm so sorry.
It's very true. No, don't be sorry. And I love your passion. And I think what it really highlights for me is that we're incredibly lucky in Australia, one, through our management of COVID, and secondly, as we really ramp up our vaccination schedule, and it's becoming easier and easier for everyone to be able to get vaccinated in Australia, and we're going to touch on that soon. We do just have another question that's come through the chat, and that's, if a person has an allergy or a high fever, I think that might be from medication, do they still need to test? And so, David, do you want to answer that, please?
Yeah, look, I think it's one of the most common debates people have with themselves. And I think most of us are so used, before COVID, we're so used to getting on with our life with just a cold, just with an allergy or feeling a bit unwell, and we think it's fine. And it was then. But the problem with COVID is it's a very tricky virus. It can look exactly like an allergy, look exactly like a fever from something else, or make you feel just a bit unwell like medication can do. It can do all of those things. And so things that we once thought about as a cold, an allergy, or a medication side effect, have to think about COVID now. And it's frustrating, and having a thing put up your nose isn't pleasant, but it's important. because COVID is just quite sneaky. It's quite tricky and very hard. You know, if you took 100 doctors and you said, does this person have an allergy or do they have COVID? It's impossible to tell. And the only way we can tell for sure if it's COVID or not is with a test. So it's a fantastic question, and thank you for asking that. And it's probably the most common thing that goes through people's heads. Yeah.
Thank you, David. That's really great. I'm being told there's a few hands up, but because of all the screens, because there's so many wonderful people attending, I am struggling to see the hands. I'm wondering if someone else can see a hand, can they let me know? Sally's going to keep an eye, and I do just see there's a question in the chat again, and that is about the vaccine and some rumours that it may cause infertility. Can you address that, David, just while I know it's not your complete specialty, but just while we're on it, please.
Absolutely. I think the short answer, no, it does not cause infertility. And it's a really important question. It's one of those things that has been used, I think, particularly in movements that are very against vaccination. It's often a message that's put against a false message that's used to push people away from vaccination. And it's been used for, against every vaccine that's been so valuable to human health over the last 50 years. This infertility thing keeps coming up, and it's not true. There are a lot of other reasons that people want to push against vaccines, and there are groups of the community and population that have their own reasons for that. But fundamentally, as a doctor, as someone who trusts science and trusts the experience of medicine and the use of vaccines over 60, 70 years that we've had them, infertility has never been a problem with vaccines. And it's really important that we base that on fact. Yep.
Thank you. I just want to ask if, before we proceed with any further questions, is Professor Ben Cowie online now? I just can't see.
Yep.
Not yet?
Yeah.
Okay, so can we please go? I understand that Tuan Bui may have had a hand up. Tuan, do you have a question?
Yes, I do. Hi.
Hello.
In our organisation, we encourage our staff to install the COVID Safe app way back when. Mm-hmm. And with the current QR check-in code situation, if we use COVID Safe app, do we still need to check in? Or what's the story around that? And also, I would like to support Mr. Bond's comments earlier. Very common. We listen to our elderly, and the mixed messages from the government is not helping. One of the things that the thing that I heard my own sister saying is that, and we're above 50. If you wait long enough, I think in November, you have a choice of Pfizer or AstraZeneca. So the message needs to be clear, and also the fact that that if you are over 50, or the blood clotting, which is preventing or scaring a lot of people regarding AstraZeneca, that is only affecting younger people, and hence the reason for people above 50. The government is still encouraging people to use AstraZeneca for people above 50, and that needs to be made very, very clear.
Yeah, thank you, Tuan. And perhaps, before David, you provide any more comment to that, just remind people, we will be touching on the vaccination after this in a moment, but also just encouraging you to receive your information locally. So if you live around Richmond or you live around Collingwood or Fitzroy, please come down and have a chat to our staff, because we can provide genuine local information that will apply to you, rather than some of the mixed messaging that comes through different newspapers and things like that. So it is very confusing. David, did you want to comment at all there?
Yeah, absolutely. Raises lots of excellent points. So the QR code system is something that's been absolutely crucial to our contact tracing this time around. It's not perfect. No one can pretend that any system is perfect, and it's not perfect, particularly because not everybody does it. If every single person scanned their QR code to every place they went, then it would be fantastic, and we'd be a lot more sure that we've found everybody who could have been exposed to the virus. So scanning the QR code is absolutely crucial, and the QR code system is something that's really important now that society has opened up so much. Different solutions for different problems at different times, and I think the QR code has been really important to the current problem and the current outbreaks. The COVID Safe app was introduced last year in a time when things were very different and our movements around society were very different. It's not so much of a priority now, to be completely honest. I think that priority in terms of how we contact trace is the QR code system. So if we're going anywhere, and particularly once we start to open up again, it's so important. From being at the side of the problem where I'm trying to find everybody who's been exposed to the virus, if their name isn't somewhere, if their phone number isn't somewhere that we can see, then there's no way of telling someone you might be the next case and you might then pass it on to your family. It's really important that we catch them in time so that we can help them protect their family, help them protect their community. I'll leave Ben to talk more about the vaccination in detail. He's going to
Thank
be
you.
Better.
We just clarify Ben's arrival or someone that will stand in. We'll just take a question from Satina, please.
Hi everyone. Thank you for the invitation, and thank you Emma and Sally and Fozia for organizing and sharing this to the community. My question is that regardless when you do this info is a great information that passes into the community, but how would we translate, like one of the interpreters are going to translate it while you guys are expressing the information or telling the information? But is it like because the community, I know like most of them, they might get frustrated about the COVID tested or vaccination, but how would be this my idea of getting within the community, having that organizing and then telling, passing that information to them within their own languages, and when languages are being translated to them so that they can hear it from within their own languages and pass by, so that they, at least they can understand. I can see a lot of people are leave out the one I invite because there's no pause or translating through to them, so it's in English, and it's so the language barrier also is going to be like getting enough information for them. So we have to broadly thinking of who are we talking about. If we're talking about the community, are we including the translation, the languages, the resources? Also, are we passing the language together, one person translated, one person are pausing, within the city of Yarra, there's many languages. We're bringing all these many language in one and passing information. It's not going to work, because if we go individually, that translation languages, that can be, at least we can target the people and get understanding of the COVID vaccine. That's what I'm thinking.
Thank you. Thanks, Satina. And look, you raise really good points, and we do try and I think that's the joy, hopefully, of the teams that we have at Cohealth and North Richmond, is that we employ a really diverse community with multiple languages, many of who are on the chat, tonight. And but I think that, if there's languages that you feel we miss in our information that we provide through the tents and our outreach services, please come have a chat with us. Please let us know that, because we can always get more translated information. We don't know if you don't tell us. So please, if you think that there's something that we're not doing, we would really love to hear that so we can constantly improve. I'd now like
Can I just quickly jump in, Satina, in a minute? We're going to talk after Ben. I'll let you know we're running a couple of a series of these same sessions, like COVID information, vaccine information sessions in language. So I'll provide the details for when they're going to be and how to access those afterwards.
Thank you, Em. Yep, we'll touch on that afterwards. I believe we're welcoming Professor Ben Cowie to the conversation. Ben, are you there? Can't see you.
I sure am, Laura. Hiya.
Hello, welcome. Thank you very much for coming on board.
Of course, happy. It's an honour to be here. Thank you for the invitation, everybody.
And so we're going to hand over to you to talk about the current sort of vaccination, what's happening in the vaccination space, maybe bust a couple of myths, and also talk about how, how the community here are now eligible, and then Cohealth and North Richmond will talk about how they can access them at our centres. Thanks, Benjamin.
Absolutely. Thank you so much. So, colleagues, it's a great pleasure, as I said, to be here tonight. I'd like to acknowledge that I'm currently on the lands of the Wurundjeri people of the Kulin Nation, and I'd like to acknowledge their elders past, present and emerging, and acknowledge any Aboriginal people who are here with us on this call tonight. So I will work through my slides. I'll try and make them as quick as I can, because the best part is always talking and discussing and hearing advice and answering questions. So I'll get to that as soon as I can. And if someone would allow me to share my screen, that would be great. I think someone's going to have to give me permission to share. So if someone...
onto it.
Great.
One sec.
Thank you.
Laura, while we're waiting, there was just additional question about the COVID app and whether you need to have it turned on. I'm not sure if David's able to answer that to be tracked, just while we're back on.
Yep, absolutely. I'll get everything switched on again. Yeah, look, I think we sort of went through that just a minute ago. I think the priority, particularly in recent times, has really been around the QR check-in. And I think that's the thing that's been the most useful and the most helpful, and the thing to really be absolutely, getting that message out is that if you've scanned in on your QR code at any place you've entered, any shop, any restaurant, any cafe, wherever, that means that if you were exposed to COVID at that time, we can find you, we can tell you, we can get you safe and get you in a position so that and you can keep your family, your loved ones, your community safe. So that's what I'd be prioritising.
Thanks so much, David. That's great.
That's great.
Over to you, Benjamin.
Awesome. Thank you. Good to go. Okay, so I will talk a little bit fast. I'm sorry about that, but I do want to give time for questions and answers. So the first point I'd like to make is that in the same way that we've had to change the vaccination program several times, there's been twists and turns along this journey. One of the most important things we've done is to respond to the needs of the community, particularly in the current setting where we have the outbreak response, and knowing that the vaccine is a really, really valuable and important new tool that we can use to help control COVID-19 in our community. It's not the only tool. We still need to do all the things that I'm sure you've been talking about already this evening, in terms of following the public health directions, ensuring that if you have any mild symptoms, you go and get tested and isolate until you get the result. And practicing all those COVID safe behaviours, which we've learned over the last year, can keep us safe. At the same time, the vaccine program has been really expanding our workforce, expanding the number of clinics, particularly in areas where there is active transmission and other areas where we have priority communities to protect, including, obviously, residents of public housing towers. And the communication side is very important. And I think as I joined the session tonight, there was discussion about the importance of communication and engagement. And again, that's what sessions like tonight are all about. And that's in two directions. Obviously providing information, but us also learning from you and hearing your questions and also your answers to our questions. So important to keep that dialogue going at these times. So there are a number of key messages which I'm sure you've been through. If I could add one more, and that is I am so proud and grateful of the Victorian community coming forward in the numbers they have and getting vaccinated. So yesterday, over 21,000 doses of vaccine given just in our state system. And over the last week, essentially every day, we've averaged around 40,000 doses of vaccine between our GPs, and between our state services, including the fantastic work done by our Cohealth and Star Health and other community health centres in vaccinating our community. So this really is a fundamental drive to protecting us from COVID-19 and reducing the risk of us having to go into lockdown again in the future. So in Victoria, now over 1.5 million doses of vaccine have been given by both GPs in our aged care and disability care settings and by our state services. And we are charging ahead faster than any other jurisdiction. And it makes me proud and really grateful to our community. So one of the big questions that really comes up is who can get vaccinated? And there's more and more groups being able to be vaccinated as Victoria and as indeed the rest of the country open up more eligibility. Many of you may have been aware that about 10 days ago now, the government made everyone aged 40 and over eligible for COVID-19 vaccination. There's a range of other priority groups, and really important for tonight's session, everyone living in public housing, in high-rise public housing and other settings where we're very committed to protecting the residents. Everyone in public housing towers is eligible for COVID-19 vaccination from the age of 16 and over. So that's very broad eligibility, and really happy to talk about that some more. The other important point that this slide touches on, and I'll talk about in the next slide, is that people aged 50 years and over will be offered the AstraZeneca vaccine, and people under the age of 50 years will be offered the Pfizer vaccine. Now, these are both very effective vaccines. Both have been shown, even after the first dose, to reduce the risk of getting seriously ill with COVID-19, reduce the risk of having to go to hospital, and reduce the risk of loss of life by 90%. So both very effective. But the reason that we give Pfizer vaccine to people aged under 50 is because of this very rare but potentially serious side effect, which is more common in young people, which is associated with some clotting in the blood. Now, this risk is around one person affected for every 100,000 people vaccinated. And it's also important to note that this side effect is now milder than we first thought, and that's partly because we know how to diagnose it or to test for it very quickly, and we can treat it with specific treatments in hospital now. It's very tragic. One person has lost her life from this complication or this side effect in New South Wales, a woman in her 40s. But that's out of 2.3 million people vaccinated with the AstraZeneca vaccine. Any loss of life is tragic. What the vaccine is trying to prevent is the hundreds and thousands of lives that would be lost if we had another wave of COVID-19 in Victoria. And that's what we're trying to prevent. So this is why under 50 years, people are offered the Pfizer vaccine, and for 50 years and over, the AstraZeneca vaccine, because the risk of that very rare side effect is more common in younger people. So how do people actually get access to these vaccines? Well, in many public housing settings, as we've been discussing, there will be on-site vaccination on offer from our fantastic partners in C19, the community health centres. But there are a range of other options. Many GPs are providing AstraZeneca vaccine at their clinics. Our state services, including the high volume or the large vaccination centres, are also accepting both bookings and walk-ins. The bookings are made by calling that hotline 1-800-675-398. And I apologise to anyone who tried that number last week and didn't get through. We've had millions of people, usually last week about 300,000 people every day trying to get through. And we've got 1,000 people working on that hotline. But if you've got thousands and thousands of people calling at any one time, it can lead to some delays and challenges getting through. But it is getting easier as of the last couple of days. So if you tried and want to again, please try again. The website there also gives a list of all the other centres, including those where you can do walk-in appointments for both Pfizer and AstraZeneca, depending on age. But really emphasising, as we work with public housing, our colleagues in the Department of Families, Fairness and Housing, and the residents and all the other stakeholders in this space, we will continue to seek to provide local options on site for as many people as we possibly can in the public housing setting. So I'm not going to go through all this list of people who can get access to vaccine. Really, I guess the critical point here is that anyone who's living in public housing, particularly the high rise or the high density public housing, is eligible if you're over 16 to be vaccinated right now. Apart from the very rare but potentially serious side effects, it is true that there's a range of other side effects from these vaccines, just like any other vaccine. And so those side effects are often a sign that the immune system is reacting to the vaccine. Things like pain where you have the injection, or feeling tired, or feeling a bit of a headache, or maybe muscle aches and pains. They're quite common, and usually they start the day after you had the vaccine, and by the next day, they're all gone. So they are quite common and important to be aware of them. So we are opening a range of different clinic locations, over 48 open access clinics now in Victoria, but also our fantastic community health centres and GPs, and that hotline again to call in for yourself or your members of your community or others who would like to get vaccinated close to home. So there are some challenges. The whole question of Pfizer versus AstraZeneca is a hard one to explain. The other is the idea that how are we going to get the right vaccines to the right people at the right time? And we have a lot of colleagues working very hard to make these accessible to everybody, or as accessible as we possibly can. I'm not going to read through these, they're small, it's written quite small. This is resources for later. There's a range of different concerns people have. Some of them are really not based on any sort of evidence, or they're really coming from incorrect understanding. And it's really important we address those, because that's supporting people to make choices based on real evidence. I think some of the really important messages that always come up is about vaccines and safety in women of childbearing age. And so, for example, these vaccines have no effect on fertility. They in no way are a problem for women who are trying to get pregnant. It's fine to be vaccinated. It's fine to be vaccinated if you're breastfeeding as a woman. It's currently not routinely recommended to have the vaccine during pregnancy in Australia. We know that plenty of women who are pregnant have been vaccinated overseas when there's been a lot of COVID illness in the community. We're not aware of any problems from the vaccines, but because we don't have a lot of COVID here, we're not routinely saying women should be vaccinated if they're pregnant. But breastfeeding or planning pregnancy, totally fine. So again, I'm running out of time. Very quickly, over 1 billion doses of vaccine have been given globally. We are constantly monitoring safety. We need to continue to work with communities, because what's in the media, I'm sure you all understand, is not always the correct or the whole truth. And really a fantastic source of information is your healthcare provider, your trusted GP, bicultural worker, someone else who you trust about your health information is the best source of information about vaccination. So thank you so much for your time, and I'm happy to take any questions. Thanks so much, Laura.
Just going to thank you so much, Benjamin, for coming online and explaining that to everyone. Before we go to questions, I'm going to hand over to Cohealth in North Richmond. I think I'll give you, as the chair, 2 minutes each just to talk very briefly about how our community can access a vaccine, and also briefly touch on some exciting vaccination information in language sessions we've got coming up in community. So over to Cohealth, maybe Ash, is it?
Yes. Hi, everyone. So very briefly, just wanted to give an update about how people can get vaccinated, and Ben's provided some fantastic information for people to be able to call in. And I wanted to let everyone know about our clinic. So we've started operating a Pfizer and AstraZeneca clinic at 140 Brunswick Street in Fitzroy. And tomorrow morning, I'm really happy and really pleased to be able to say that we're opening up a Pfizer and AstraZeneca clinic at 253 Hoddle Street for the Collingwood high-rise residents. So these clinics are all walk-in. We haven't had many lines since we've opened at Fitzroy. So we vaccinated around 60 people today out at Fitzroy, which is, we've steadily seen an increase as the days that we've been open have seen over the past few days. So there isn't really a line. Please come down and get vaccinated. If there is, we're there from 10:30 to 4:30. So please, come back, or we'll be happy to make you a cup of coffee while you wait in line. And if you've got any other information, we've got registered nurses, doctors, as well as our community health nurses. So hopefully a lot of you know Aaron from Fitzroy and Sally from Collingwood. Those guys have got a huge amount of information and are able to escalate any of your concerns that they're not able to answer, and able to get you a response as soon as possible. As David pointed out a bit earlier about testing, we've also got our testing clinic on 365 Hoddle Street. And our community health nurses are also able to provide in-house testing. So for whatever reason, if you can't get down to a testing clinic and you need us to come and test you in your apartment or your house, then we'll be able to support that as well. So the community health nurses can do that. So please speak to your health concierges, speak to your community health nurses, and the clinics are on site Monday to Saturday from 10:30 to 4:30. And as Ben pointed out, anyone under 50 will be offered the Pfizer vaccine. Anyone over 50 will be offered the AstraZeneca vaccine. And if you are over 50 and you're looking to get the Pfizer vaccine, we'll make an assessment and we'll do a referral to the appropriate agencies, and we'll do that piece of work for you. I think I'm just going to pass over to Em, who's got some information about some of our community forums that are coming up in languages.
Thanks, Ash. Sorry, we're just still trying to share your slides. Sally's working behind the scenes, but sometimes, as you all know, it's a bit trickier than usual. So, Em, just keep chatting, and Sally will just work away and might have some success in a second. Thanks.
Here we are. Hi, everyone. Thanks again for coming along tonight. And it's really good to have everyone here. I just wanted to quickly talk about. Ash had talked about where the clinics are, but we just wanted to say about how we want to continue to work with the community. In particular, we're hearing about how more information needs to happen in language. So we have a team of not only the health concierge that are based on site, but we've also recruited a team that are working across different community settings to provide information in language. So we're going to have a, following next week, so from Tuesday, Wednesday and Thursday, we're going to have these information sessions where you can find out information about the vaccine, speak to a clinician about vaccine information, as well as our health guides to talk to you about where to access information in your language. So where to find it online, or where to help some of your elders get that information if they don't have it themselves. The tricky thing at the moment is that everything is really, really online. So finding out where your exposure sites and things like that are very heavily based on online settings, so we can talk to you about where to find them. So here's where the clinics are for those in Fitzroy. It's on the Brunswick Street site at 140 Brunswick, and those that are in, that's where the vaccine clinic is. You can also head just nearby to 365 for testing, and for vaccinations, 253 Hoddle is where you can get your vaccines in Collingwood. But yeah, for the sessions in language, I'll just get the next slide, just the next one after that one. Oh, there we go. Yeah. So these are the sessions we'll be holding next week. We're going to hold just sort of 3 consecutive sessions, knowing that everyone's not always available. So we'll have an Arabic, Mandarin and Vietnamese session next Tuesday, Wednesday and Thursday. If you would like to attend this session, if you could please just put you can either send it to me as a private message if you know how to do that. Otherwise, you can send it in the chat if you'd like to put your name, contact details and which language you would like. We'll send through the invitation to you. So if you want to attend any of these sessions, just send me a personal message in the chat, or you can put it in the group chat of your name, either email or phone number, and what language you would like to attend, and we'll send you the invitation. Thanks very much.
Fantastic. Do you think another option is, would you be up for putting your email address in the chat for people to just reach out if they're not sure of all those other details too?
Absolutely.
Yep, so Em will chuck that in the chat. Thanks so much, guys, for sharing that. So I'm just going to hand back to Brendan for North Richmond just to touch on our local Richmond information here.
Thanks, Laura. So from today, we are offering 2 days a week, Tuesdays and Thursdays from 10:30 till 4:30, both the Pfizer and AstraZeneca. So anyone over the age of 16 living in public housing can come and do not need to make an appointment. It's a walk-in clinic. In addition, on Wednesdays and Fridays, the same time slots, 10:30 till 4:30, we have the over 50s clinics, and they are appointment based. And you can get appointments through coming to see the concierge staff who can book through Hot Docs for you, or phoning the North Richmond Community Health Centre, or the Big Green House, as everybody calls it. So those clinics are Tuesdays to Fridays. That started from today. So we had our very first clinic on site today. So thank you to everyone that turned up. We also have a number of information sessions for community. There's the information there. I'll let you read that while I talk about. So next Tuesday, the 15th, and Wednesday, the 16th, there's a session at the Richmond Library in partnership with Carringbush. And we've got languages supported: Vietnamese, Mandarin, Amharic and Oromo on Tuesday. And we can put that information in the chat as well. And then on Wednesday, languages is Vietnamese, Mandarin, Cantonese, Arabic and Somali. And the following week, we also have 2 sessions on Monday, the 28th of June and Wednesday, the 23rd. And they'll be at Belgium Avenue Neighbourhood House, and we'll also support a whole range of languages at those 2 sessions. So in partnership, again, with Carringbush, but also with Belgium Avenue Neighbourhood House. So thank you to them.
Thank you very, very much, Brendan and Em and Ash. And just notice also Emma Bathgate is just advertising that there's a food relief program in partnership. I've seen Sue Kent from Belgium Avenue here. Sue, are you there to put your hand up? There is a food relief program happening at Belgium Avenue Neighbourhood House at the back of the big green building tomorrow, where there'll be more vaccination information. So I'd just like to now open it up to questions around vaccination, directed mainly at Benjamin, please. Does anyone have any more questions? I'm mindful of time. We do need to wrap up in a moment, but if there's any burning questions, we can probably just take just a couple of minutes to answer some of those, and otherwise put them in the chat and we'll do our best to get back to you in some format. I see any hands. No, it might be dinner time for everyone.
I think so. People have had a big day.
I think so. Hopefully you've got something really, clear out of tonight, got some more information, even also to pass on to your local communities. Again, I'll just reiterate that if you need more information about vaccination, testing, anything COVID related, please come down and see us at Cohealth and North Richmond Community Health. We are here to work with community and we take our role really, really seriously. We just encourage you all to get tested. Just to touch on David's points, if you've got the mildest of symptoms, just a sniffle, please come down and see us at the tents for testing. I'm seeing that there are a few questions in the chat. We're going to take them on notice because I just think it's time to wrap up this evening. And so Sally will write those down and we'll work out a way of getting back to you. Want to thank all of our teams working across Cohealth and North Richmond Community Health, our partners, the Department of Families, Fairness and Housing, and our guest speakers from the Victorian Department of Health tonight. And most importantly, we want to thank our local community, because we just know that you're just doing such an amazing job here in the city of Yarra, and we just, you know, feel so proud and so fortunate to work alongside you. So, you know, thanks very, very much to everyone, and enjoy your evening. Thanks. Sally, have you been able to scribe those questions for follow-up?
I've copied and pasted them all into a Word document. So yeah, it's sorted. Thanks.
Fantastic. Thank you so
Thanks,
much.
Laura. I was just grabbing the last of any ones that were putting their names in, and then I'll...
Yeah, good. Yeah, no, that's fine. No, we'll hold on. Good on you.
All right.
So any ones that we might need to get to Ben, I'm very happy to forward those on to Mel and Ben as well.
Thanks, Mary. I think Em's done. Susanna, you good? Sorry, Sally, you good?
Yeah, do you want me to just...
I think we might, yeah, might end.
Yeah,
okay.
lovely.
Thanks all.
Cheers.
See you. Thanks, Sally. Bye.